Howdy, thank you for finding your way to Advancing Peer Services for Pregnant and Postpartum Women with Substance Use Disorders. I have the privilege of introducing my friend and colleague, Maureen Nichols. Maureen is the Associate Director of Programs for the Addiction Research Institute at the University of Texas at Austin Steve Hicks School of Social Work, and the Director of the Southwest Addiction Technology Transfer Center. And if you've got a printed program, her name probably isn't showing up on this session because she willingly stepped in to cover for a speaker absence, but she's quite expert and has excellent experience in terms of supporting education for and ongoing support for peer recovery support services providers. So really excited to get to learn from her today, and I'll let her give a little bit more introduction on her background as she shifts in, and we let people leak in from the hallway over the next 2 minutes. So please join me in welcoming Maureen.
Hello, everyone. Thank you so much for the welcome. And as Lucas mentioned, I guess I'm going to start out my presentation by saying I am sorry to say I am not Sharon Hesseltine. For those of you that know Sharon, she's a wonderful speaker and an expert in this area around maternal health and peer support. She had a family emergency this week and was not able to come, and she was very sad that she isn't able to be here and wanted me to send her regrets. I am going to present her slides, and I'm going to do my very best to live up to the excellent presentation she always gives in this area. I just am going to trust that everyone here is going to support me. If I run into any issues or any questions that I cannot answer just because I don't have the depth of expertise that Sharon does on a particular topic, I will be sure to take those questions, get them back to Sharon, and put them in the Whova app so you'll get a response to everything you ask. But hopefully I can do my best to fill in Sharon's shoes, and we can have a really good conversation. The other thing that makes me confident is I know there are many people here in this room that do peer support and support pregnant and parenting families, and there's a lot of expertise here. So I'm going to rely on all of you as well. So, as Lucas mentioned, I work at UT Austin in the Addiction Research Institute, and I am the Associate Director of Program and Program Implementation, and we do a lot of work on training, technical assistance, and evaluation around peer support services in a variety of different ways. So I'm going to talk about some of the resources that are available through us and through other SAMHSA-funded technical assistance programs that are available nationally, and so I'll get into a little bit more of that as we present. As the other speakers have mentioned, this presentation is supported by the Texas Targeted Opioid Response, a public health initiative from HHSC. The views expressed here do not represent the official policies of either the federal government, the state government, and they are explicitly my opinions and the opinions of Sharon Hesseltine, who wrote the slides and is not here, but none of these funding agencies do we represent in that way. And I have no financial relationships to disclose. So the learning objectives today are fairly broad, and we're going to have plenty of time for conversation and questions and answers. So hopefully we can get into some of the more specific topics you might be interested in talking about around peers supporting pregnant and postpartum families. But to get things started, we're going to talk about some key takeaways for frontline peer support specialists that are working with these families, and what are some of the pieces that really go into a comprehensive peer support for pregnant and postpartum and parenting families. And we're also going to talk a little bit about how to develop state, community level workforce development plan to further support peer support specialists who are working in this area. And I'm going to give an example of of a plan that was put into place in the state of Missouri and sort of how it came together with a variety of different partners across the state. And that's also when I'm going to talk about what some of the resources that are available that others can take advantage of, including folks here in Texas. So just to get things started, how many peer support specialists are in the room? Okay, lots. Yay, that makes me happy. Now I know all the expertise is here in the room, as I suspected. For anyone that is coming to this presentation that isn't familiar with peer support and their professional role, I thought I would just take a moment to talk about what it is and how it's defined using the TxSUS Peer Specialist Core Training. This is the training that certified peer specialists in the state of Texas go through in order to get their certification. So very broadly speaking, in a general sense, peer support is defined in the core specialist training or core peer specialist training as building genuine human connections through empathy and shared experiences. So that's a pretty broad definition. It can apply to certified peer specialists and the work they do, but it can apply in a lot of other areas as well. The peer professionals that do the work, and in the state of Texas, there's several peer specialist certifications. Recovery support peer specialists who work with people with substance use challenges, mental health peer specialists who work with people with mental health challenges. There's also justice-involved certification. Those peer and certified family partners who work with family members. These peer professionals are people with lived experience who work in an official capacity, it can be either paid or volunteer, and are trained in peer support competencies and pass a certification exam. And we always like to kind of circle back around to the values that professional peer support specialists center their work on. There was a lot of talk this morning about values and how values underline everything that we do in this work. And so the values for TxSUS peer support specialists and their services are recovery orientation, person-centered, relationship-focused, trauma-informed, voluntary, self-determined, and dignity of risk. Talking more specifically about the peer support specialists and the work that they do supporting pregnant and postpartum and parenting families, there's sort of three broad buckets that I'm going to talk a little bit about here today. One is the quality of peers, sort of how they are and how they do the work. There's also the bucket of the knowledge that peer specialists, peer recovery support specialists bring around all the aspects that touch on the group of people that we're talking about here today. So we're going to go a little bit into the knowledge piece, and then we're going to talk a little bit about the storytelling, the lived experience, and how peer support specialists share that lived experience in the work that they do. So this particular list of qualities is one that came from a 2019 qualitative study that was a series of interviews with people that had received services from peer recovery support specialists. The people that were interviewed were women that had opioid use disorder and were receiving treatment and were parenting children under the age of 5. And they asked, it was a very small sample, 9 or 10 people, but they asked them, what is it about your peer recovery support specialist that really helped you in your recovery journey? And these are some of the, in this particular study, these are some of the characteristics that the people receiving services mentioned. And these are not, in any means, I don't think these are the only characteristics, but these were the ones that came up in this particular study. The people that they interviewed talked about the authenticity of peers and how they shared their true selves with the people that they were supporting. They also talked about the support that the peer specialists gave, and the phrase that was used in the report was, or in the study was, while providing accountability. And Sharon and I had kind of a long talk about that yesterday because that word accountability can be a somewhat tricky one because it tends to lean on perhaps some terminology that can lead to role confusion. For instance, peer support specialists are not sponsors. They're not in any position of authority over the individuals they support. They walk alongside them. So what Sharon really talked about is around that component is really that peer support specialists talk with the people they are supporting about what they want in terms of their own life in their natural community, what kind of support they want for themselves. What do they want to set up in terms of putting supports in place that will help them meet their goals in the meaningful life they hope to have. So it's really much more self-directed and not from a position of authority. Also talked about the holistic approach, which was mentioned again in the earlier sessions today, that support extends beyond the concept of sobriety, that there are multiple pathways to recovery, and each person defines their recovery in their own way. And then they talked about the value of having the peer support specialists that had sustained time in recovery and how they were really role models and provided hope to them about changes that can happen in their life. So these are some of the ones that were mentioned in this particular study, but I'd like to throw it open to the audience. What are some other qualities that peer support specialists bring to the role in supporting the community? Yeah. Resource broker? What else? Pardon? Advocacy, their ability to advocate. Lived experience. Listening skills. Cheerleader. Mentor. Acceptance. Gap filler. Open-minded. Empathetic. All of those things. So much more than that. So the next slide that I'm going to show is a very brief video that was put together of some peer support specialists that serve families and also some of the families being served, and they're going to talk a little bit about their experiences. And so it's just a couple of minutes long video. And as you're watching the video, if you can kind of watch for some of those characteristics that we talked about, both the ones on the slide and the ones we just talked about here in the room.
It's very heartbreaking because you have these warped lives of blameless children.
When you suffer from addiction, everything is a problem.
I shut down and I just gave up.
This is what my dad had to go through. But you're gonna have kids at your feet that's gonna wanna eat, or they wanna play, or they just wanna cuddle.
People are internally suffering and don't know how to reach out for help.
But I know what it feels like to be a parent in active addiction.
I was once right there.
My sobriety date's December 10th, 2016.
I have been sober, this March will be 5 years.
I've been sober 14 years.
I've been sober for almost 7 years.
My dad was an addict, God rest his soul. Died with 10 years sober.
My mom will have 26 years.
For me, that means I haven't misused substances since February 4th of 2004.
I thank God for my mom, because without my mom, I probably wouldn't be here today. She held me accountable. She showed me tough love, but she never gave up on me.
The interviewer asked her, are you afraid that your mom will relapse? And she just so confidently was like, nope, I know she won't. How does this little girl have more faith in me than I have in myself?
You know, I mean, I absolutely love that I have a baby that trusts me, that loves me, that, you know, wants to be around me.
I must say God. I have to give him all the praise and glory for my life and for instilling in me that you could do it, because I didn't know what to do.
We're breaking the chain of addiction and trauma, and it starts with us.
I kept wishing we had something specifically for peers who work with pregnant and parenting families.
I don't feel like we could effectively do the work that we do without peer support specialists.
So sometimes when you have a client that wants to just walk out of the door, throw in the towel, you have that peer support that when they feel like nobody can relate, they can say, I can.
And the more she began to take time with me and the more she began to teach me, you know, I began to want to change.
I came in contact with so many different people in active addiction that today I can share my story with everybody.
You can just see it in her demeanor. She's opening up, she's talking more, she's changing what she's doing.
And having support to be a thinking partner around where do you want to go? Where do you want your life to look like? How are you going to get there? All of those things are part of the recovery planning process.
Give us a chance. Give us a chance. What's the worst that's gonna happen? Because the streets are always gonna be there.
But when you get that one win, if that would just change your whole mindset about what you do.
I would love to see kids not have to wait until adulthood and walk around with anger or this rage.
There's a lot of, internal sense of self that needs to be rebuilt.
They need to know that it's not their fault, the reason mommy's this way.
I want these women to believe in themselves.
So did the video, do you all feel like it illustrated some of the qualities we were talking about? Yeah. What's kind of been your own experiences around that? Yeah, or just doing the work, for those of you that have done the peer support work. Being an encourager. Yeah. That you're the one that's not going to give up. Yeah. 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 That can't be taught in a book, I don't think. Mm-hmm.
Okay, so for me, what I got from that video is, so at one point in my life, I was that woman that was in treatment getting that hope and being guided from, a coach, and now I'm the coach at that same facility. So that video just really made me emotional, but in a good way, Yeah. It's so impactful that these women had on my life, and now I'm able to be there for women myself because of those coaches. Yeah.
Yeah.
Hi, I'm Tanya with Texas Clinic Healthcare System. We're a MAP program in Houston. I do a lot of NAS work. I work with women who are pregnant and have OUD diagnoses. And the question I have, because I work with a lot of the ladies who are in the Harris County Jail, who are pregnant, put on a MAP product throughout the course of the pregnancy. And one of the things that we see is after she gives birth, she's really treated like an incubator. That all she was there for was to do what we asked her to do, to take care of the baby, and then once the baby's born, she's now sort of disposable. One of the things I don't see with my Harris County NAS women is peer support. Is there peer support in the jail systems in Houston? And if so, if not, why not? And if so, how are you engaging? Because I've never seen a peer support person come in that building with that woman, talk with her. I'm trying to keep her engaged, but the jail doesn't care if she doses now because the baby's in NICU, right? So she has zero support. She was supported 100% as an incubator. And then once she delivered, she's non-essential. That is where peer support would keep her engaged. Does it exist in Harris County Jail? And if not, why not?
Is there anyone here from Houston? Santa Maria,
As of right now, for situations like that, as far as my knowledge, and I'm totally agreeing that I think that there should be, absolutely 1,000%. There is not. There's coaching such as you know, Rick Court, all that stuff. And they make their visits like once a week or once a month, whatever it is with these women. But as far as the pregnant women who are getting dosed at Texas Clinic, no, there is none. There is none, and there needs to be. And I back that up 1,000%.
The Harris Center does have a peer reentry program where basically mental health peer specialists go and do in-reach peer support at the Harris County Jail and then help connect people, to the Harris Center once they're released. So the jail seems to be open to it since they let LMHA peers go in, but I don't think there's anything specific to women with NAS. Yeah.
Hi, I'm Nicole, and I work with Santa Maria, but I used to work with the Houston Recovery Center. They do have coaches that's in the jail. The thing is, once they get out of jail, they lose contact with the coach. Well, I don't know if they have it now because I'm not there, but I did used to be one of those coaches.
So maybe after we can kind of congregate up front here and see if we can't get some connections, and there may be some folks that are not in the room here too that in Houston that I can potentially, we can do some networking and see if we can't connect you with some folks that can kind of start to be solution driven around that situation. Everyone from the peer support division at the state to folks doing the work on the ground. So let's find out who's out there and see if we can't get you connected. So come see me afterwards. Anyone else before we? The other thing that is really important, an important component of the peer support work with families, with individuals who are pregnant, postpartum, parenting young children, is that there's a knowledge base, and it's a fairly extensive knowledge base around a lot of different issues in terms of pregnancy and parenting. And these are a few of them. And not anyone necessarily comes into doing the peer support work with families with all of this fact-based knowledge, up-to-date research on all of these topics as part of their toolkit. And so one of the things that Sharon really emphasizes and really focuses on is providing training. And I know that Sharon has done some training here in Texas. She has a 2-day training for peer support around this topic. Has anyone here been in her training? Some folks have that are in the TTOR funded programs, I believe, were offered that. Okay, no one here has. Oftentimes, when folks, when peer support specialists start to work with this population, they have their own lived experience around pregnancy, around parenting, if they've had a family, if they've had a pregnancy, and in general. And they may have been told things when they were pregnant or when they were going through treatment that are no longer current and up to date, or perhaps were just misinformation at the time. And so the experience oftentimes when Sharon goes and does training and works with peer specialists is folks have a little bit of experience of what that doctor said, of unlearning or finding out that some of the things they were told, it turns out maybe wasn't true when they were experiencing it for themselves. And so sometimes it takes a little bit to process through that too, that maybe you were told that something you did as a parent or when you were pregnant caused a certain kind of harm or so forth and so on, and then you find out when you go and receive more of this training that perhaps that wasn't the case. And so there's a lot of conversations Sharon shared with me in the training when she does the 2-day training that she offers around some of the fact-based research on these topics that really causes people to kind of think through their own lived experience. And so that as you develop programs where you bring folks in to do peer support, it's important to include that training and provide opportunities for people to have conversations around some of these topics. Has anyone kind of had that experience? She's mentioned to me before, for those that do the peer support. That perhaps you heard something in your own lived experience that later on when you've taken additional training, you're like, maybe that wasn't quite so true. Does that ring a bell? Because there's a lot of information that goes on around that perhaps this particular medication isn't safe, and then later on you might learn as part of your training that it is considered safe, something like that. Not too much. So one of the things that she really emphasizes is the importance of bringing in the latest fact-based research and providing training around all of these topics, because not everyone has their own lived experience, but not everybody has all the knowledge in all of these areas around pregnancy, delivery, and postpartum. And it's not moving forward. There we go. Whoops, sorry. And as well as around parenting, and being able to be provided with the opportunities for continuing education around all of these topics as you work with families. So there is opportunity to receive this training, and this is where I'm going to talk a little bit about the resources that are out there. If anyone is interested, there are 2 SAMHSA-funded national programs. One is called the Opioid Response Network, and another is called the Peer Recovery Center of Excellence. And both of those national organizations, and I have some materials about them up here, offer training around this topic free of charge to anyone in the community that is interested. So this is available, and I've got some flyers up here on the front desk if anyone is interested in getting that into your community, additional training around these topics. And then the last part of what the peer brings to this is the use of their lived experience and the ways in which they use their lived experience to strategically support people in their personal recovery and to help people reframe their challenges as opportunities for growth. And also to provide that level of hope and experience that shows folks that life can get very, very good in recovery. So that's the key tool that peer support specialists bring to this experience. Does anyone have any questions at this point? Because I'm going to shift a little bit and talk about the Workforce Development Project in Missouri. Sure. Actually, I'm going to jump a little ahead here because I think she lists it. It's called Providing Peer-Based Recovery Support Services to Pregnant and Parenting Families. It's a 2-day training and curriculum, and they also have the ability to train trainers if you decide you want to do it in a more extensive way. It is provided by an organization called the Opioid Response Network. I have the card up here on the table. You can pick it up, scan it, and put a technical assistance request into them, and they will provide that training free of charge to your community.
Hello, my name is Sasha from Texas Women's University. I'm a counseling psychology graduate student. I was curious if you know of any programs that combine peer support and centering pregnancy models, or anyone else.
I'll throw it open to the room, but specifically centering pregnancy, is that a specific model? Yes. Okay. Tell me a little more about it.
So basically, it takes women that are all currently pregnant, and they go to their medical appointments together. So as opposed to, showing up, potentially if you're by yourself, you have a group of like 5 other women who are also 3 months pregnant, going to their medical appointments, and at the end of those appointments, then they kind of debrief and they're able to talk to each other. It just seems like this would be a really good fit to kind of mush those two together. So, but I haven't heard of that being.
I have not heard of that program before. Has anybody else heard of?
It's not for treatment specifically.
So this was an idea that was conceptualized actually at University Health System in San Antonio, where they used centering for an OB clinic that specialized in OUD in pregnancy, where the maternal fetal medicine physician actually was at the centering appointments to try to form community. I know they were attempting to do it. Unfortunately, I don't know how it turned out, but I can connect with you afterward and we can figure out how to see.
So there's a clinic at Bentop Hospital in Houston, Texas, and it's called the Impact Clinic, and it's for pregnant women. They don't necessarily go to their appointments like together unless you're in treatment at Santa Maria. Then we all take them to their appointments together, bring them home together, and we're able to coach them and guide them through that way. But we also, as coaches, work with the women that come from the community to Bentop at the Impact Clinic, and we provide them with resources. They get enrolled in our Caring for Two program that we have, but they're still able to be out in the community as well. So we do offer those services and those resources through Santa Maria and the Caring for Two program to the women in community, to the community that come to Bentop Hospital at the Impact Clinic. So we do have that, yes.
Okay, so we're talking a little bit about a model that was put into place in Missouri, in the state of Missouri. And it was an attempt to bring more of this training out into the state of Missouri to the peer support specialists working with pregnant and postpartum families in the state of Missouri. And it was an example of sort of braiding several funding resources together to support the expansion of this training into the state. So there's several different federally funded training and technical assistance centers were leveraged to put it together. And it went through the Missouri Credentialing Board, which is the board that credentials peer specialists in the state of Missouri. We talked about how peer professionals are trained in peer competencies and credentialed. That's done state by state. So in Texas, it's the Texas Certification Board that does that here. And the goal was to strengthen programs and services for pregnant and parenting families with substance use disorders through offering this specialized training. And initially, it was designed specifically for peer support specialists, that profession. But what they found is they opened that training up to folks that were doing social work, to folks that were working in hospitals and lots of different settings. And they have found that professionals in those other settings also find all this information incredibly helpful that's in the training. So they recommend opening it up beyond just peer recovery support specialists. And the goal was another part of the goal was to reduce stigma specifically to pregnant and parenting families. We've talked a lot about that again earlier in the day, to the not only stigmatization, families losing their children, but also in some cases criminalization of pregnant women who are using substances. So the goal was to build a cadre within the state of Missouri of skilled and knowledgeable trainers in this 2-day training. The training itself was funded by federally funded technical assistance funds, so therefore it's free and open source, and they leveraged some of the resources that SAMHSA has provided in terms of training and TA to bring that to the state of Missouri. And here it kind of is showing how these different departments work together in Missouri to get this training out into the community. The Missouri Department of Mental Health was involved, and that would be equivalent to the Texas Health and Human Services Commission. This is the state level agency that funds and oversees drug and alcohol services in the state of Missouri. They also brought in the two middle, the blue and the green. Those are federally funded technical assistance programs. The Opioid Response Network is the one I was talking about a little bit earlier. It is a SAMHSA-funded technical assistance program that's national, and anyone in the country that is doing anything to address opioids or stimulant use can go to their website and put in a request for training or technical assistance in supporting the implementation of the work they're doing. And it will be provided free of charge. It is part of the SOAR funding, the State Opioid Response Dollar funding, that Congress has authorized over the last 6 or 7 years, and it's literally available to anyone in the community, any organization, an individual. If you go to their website, they have lots of examples of different types of technical assistance that they offer. And so the training was provided through the Opioid Response Network. The Addiction and Technology Transfer Centers, those are regional training and TA centers in the area of addiction treatment and recovery that exist across the state. Lucas mentioned that I'm the director of the South-Southwest Regional ATTC, which includes Texas, Oklahoma, New Mexico, Louisiana, and Arkansas, and they contributed some funding as well through their workforce development efforts. And then they worked in coordination with the credentialing board. So they provided this training, and they were able to provide it in person. The ATTC was able to offer travel costs, to cover travel costs. And the credentialing board was able to mentor the new trainers and provide fidelity, support around fidelity. And so they created a cadre of trainers that could train this training and that were able to go out around the state and provide the training. And this kind of shows how the different state components, state and federally funded components came together and paid for different components of the training effort. And each of the different state and federally funded TA centers had a different part. The Department of Health supported it and participated in the planning. The credentialing board really was the support structure around which the trainers were housed. And the two TA centers paid for the training and the travel costs for the participants. And there has been some additional replication of this model and providing this pregnant postpartum training in other states, including in Texas. TTOR has paid for virtual training in this area for some of the recovery support services programs funded through BeWell. They've also done it in Florida, Kentucky, and Virginia. So this is continuing to spread this particular training. And one of the components of the model that has not been implemented but could definitely be something that if a state was interested in moving forward would be of benefit would be ongoing learning communities around this and opportunities for peer specialists to get together and talk to each other as they do the work. All right. We were required to have one educational question for the end of this presentation before we go to Q&A. So this is the question. I believe it's in Whova. If I'm correct, if you go to this particular session in the Whova app on the agenda, you can click on polls, and you should be able to take this poll and answer this question, which is not a quality of a quote ideal unquote peer support specialist. A, supportive while providing accountability. B, provides factual evidence-based advice. C, authenticity. And D, holistic approach. Support extends beyond sobriety.
I've got my eyes on the results over here. We've had a few more trickle in, and I will say I got it wrong. And there's a little bit of variation, but looks like about 70% say provides factual evidence-based advice.
That is correct. Can anyone tell me why? You don't give advice. That's right. All right. Absolutely. So that's all I have for you today in terms of content, but I wanted to make sure we had plenty of time, and it looks like we do. We have a good 15 minutes here. Also, I'm all for getting out early at 4 o'clock in the afternoon. But having said that, wanted to throw it open to just general discussion and any questions you all have. This is a very broad topic, and you don't have to be restricted to what I had on the slides. Are there other questions that folks have in the room that they want to talk about?
Let me throw in one from Whova real quick.
Sure.
And that is, as a parent in recovery and a peer specialist who works with expecting and parenting individuals, I often feel like I am in a nonstop state of offering emotional support and care for others. What policies can organizations implement to help minimize the risk of compassion fatigue and burnout, and to be mindful of self-care needed for this particular subsection of the peer workforce?
The thing I really like about that question is it zeroed in on policies of the organization, because I think really that is where it starts. With the leadership of the organization and providing the space and time people need for re-energizing, rejuvenating, and bringing it, and just having time to decompress from the intensity of the type of work that you all do every day. Does anyone in the room have an organization that really is successful at that, and something that's worked for their organization around being trauma-informed and assisting staff with addressing compassion fatigue and those? Does anyone have a good example of what's been done well? Mm-hmm.
My name is Chandra. I work at Communities for Recovery. It's based here in Austin, Texas. And so I think what your question was, do I have an example of an organization that's able to support us as we provide the services, right? And yes, Communities for Recovery does an amazing job of offering us time and space to practice self-care and wellness. They do that by offering wellness activities in the center at our organization, as well as full-time employees are given 2 hours a week to do with what we find to be rejuvenating and replenishing. And so I think that's been one of the most incredible things. I never imagined a job would offer me something like that. So that's a good start if anybody wants to model that.
Thank you. Anyone else have examples?
Good afternoon. My name is Valentin Sarda. I'm with Behavioral Health Solutions of South Texas. So our agency has taken a step into that direction. We give our employees a 2-day wellness time off paid. We also have our wellness programs where we get together every quarter and go over just wellness. We do sound baths, we do yoga. They allow each sector of departments to have their own little time to go meet together at coffee shops, have breakfast. So that helps in our wellness as well. The other time is our flex time. They allow us time to really take care of our families and take care of ourselves before everything else. So yeah.
Yeah.
Hi, my name is Dr. Kimberly Scales. I'm with North Texas Addiction Counseling and Education. And we allow for time, flex time. We allow for them to put in just at any moment they can say, I need a break, you know. And we have, it's not a, there's a little area in our facility. I call it a prayer closet, just because that's what I call it for myself. But everybody has different names for it, and you can go in there and meditate or do whatever you need to do to decompose. And we also all get together in the morning, and we call it eat together. So I say, are you ready to eat? And they'll say, yeah. And we all come in and we read the meditations for the day from NA and from AA. So those are some of the things we do.
Speaking of which, there's a tranquility room across the hall with some low lighting here, and it's really nice. So if anyone has had enough of crowds and lights today, I recommend the room across the hall. And I'm staring at these two really bright lights for the live stream, and I think I'm going to need it.
Hi, my name is Dominique. I'm a paramedic with Austin Travis County EMS, and obviously we know working in emergency services, we deal with a lot of different aspects. We have to put on so many hats. So what we do when we start getting either physical fatigue or compassion fatigue, all of our commanders and all of the management staff is very understanding of, I need a break. And so they will actually maybe move around some resources and get you some time to rest, to kind of mentally recuperate from those very taxing calls, whatever it may be, whether it be trauma, whether it be opiate, we never know what we're going to get. So we have that, and we also have a service that allows us to go see licensed professional counselors free of charge, anonymous to the department in the city. So we have a contract with someone that we are able to go to, and they can also assist us with guiding us through those things.
That's great. Other questions? Or I'm sorry, one more person. Sorry, I can't quite see. Yeah.
Hello, my name's Sam. I'm an RSPS, and I worked for an organization called Rise Recovery in San Antonio, and they're an RCO, and I was just wondering if you could speak to the strength of referring these women to RCOs and a collaborative process between new mothers and then working with peers in an RCO.
Absolutely. So if anyone isn't familiar, that is acronyms. The RCO is a recovery community organization. It's a peer-run organization that exists in the community specifically to provide peer support services to the community. It's often a center hub, and then they also go out into the community and support people where they are. And so connecting, if you're in a medical setting or a clinical treatment setting, connecting the people receiving services, the women that are in need of services, the families that are in need of services, the individuals that are in need of services, with the local recovery community organization is one way to really bring that peer support around them if it's not available to them in other ways. The other nice thing I think about recovery community organizations is I always think back to something that Bill White and Dr. Ijama Chara, who was a protege of Bill White's, who does some work here in technical assistance in Texas, talks about that recovery really happens in a person's natural community. It doesn't happen in a hospital. It doesn't happen in an ER. It doesn't happen in a clinical treatment center. Long-term recovery happens in people's natural communities, and recovery community organizations can be a part of that in their community every day. Mm-hmm.
All right, I've got another HUVA question. I hope I'm interpreting it correctly, and I'm going to expand a little, but the question was about getting peer recovery support services for this population in rural areas. And
Yes.
I guess I'll tack on as a somewhat of an interloper here as a pharmacist and researcher. It feels like so often peer recovery support services are grant funded, are hospital based, are only in the city, only related to the university, or trying to get by on pulling together a few different small contracts from those type of groups. And maybe you through ATTC or your work know of something else.
Yeah, I think about that a lot in small communities, and I think a little bit back to some of the earlier days when recovery support services were just getting started with the state, and the recovery-oriented systems of care, people coming together around in a local community around how we can support recovery as a whole community. And perhaps part of the answer is just getting something started and then getting connected to the wider recovery peer support network across the state of Texas, because now after 10 or 15 years, between the fact that there's a peer services unit at the state and that there are established RCOs in different cities across the state, that if there is a group in a small community that are interested in trying to provide this kind of support, perhaps it's with a rural hospital, perhaps it's with a agriculture extension program, perhaps it's a doula that's working in a community, perhaps it's a nurse that's working in a community that wants to try to make this happen, to try and bring some people together locally to talk about what it might look like, and then tap into the pretty mature set of resources and community throughout the state. And I think one thing may lead to another, because I do believe that there is a lot of interest in expanding peer support services into areas of the state that don't have very many peer support services. And I look at the state peer unit folks that are here. I mean, if there's a group of interested people that want to try and start to get things going, there are resources you can tap into to get support. And then as it builds, then like the money could potentially follow. Does that make sense? That would be my suggestion, and I'm happy to talk to anyone that's interested in doing that, either virtually or if they're here today, I'll be happy to talk to them here today. Anything else? I know it's 4 o'clock.
Well, please join me in thanking Maureen for filling
Thank
in and doing
you.
an outstanding job.